Good afternoon, everybody. This is Dr. Robert Lowe, your friendly neighborhood pediatric rheumatologist, at least if your neighborhood is anywhere near Las Vegas. I'm coming to you this afternoon. We're going to do a special edition of the presentation where you get to call in or send in any of your questions that you have. There's no bad questions, and I'm willing to answer anything you have. If burning questions that maybe you were afraid to ask other doctors, or if your child already has a pediatric rheumatologist, questions that you have that maybe weren't fully answered when you've asked questions before. We've got a few questions that were previously submitted that we'll cover in between questions, but we're open right now for you guys to ask anything you want. So while we're waiting for our first question, one of the pre-questions is, am I getting chemotherapy for my arthritis? Isn't it the same drug as used for cancer? Okay, so we're talking about methotrexate here, which is a medication that is indeed used for chemotherapy. That is used for chemotherapy in kids and adults with cancer, but we use it in 1/100th, so that's 1% of the dose that's used for people to treat cancer. At this dose, the methotrexate is not harmful in terms of causing hair to fall out. There's often minimal, if any, nausea associated with it, and it's generally very, very well tolerated. So if your pharmacist, when they fill your prescription for methotrexate for your child, ever says, well, your child's on chemotherapy, don't be shy about correcting them. Say, no, my child is on immunomodulatory therapy. This medication, methotrexate, does not kill any cells, good or bad, at this dose. It simply helps correct the behavior of the misbehaving cells that are attacking the joints or other tissues in my child's body that has an autoimmune condition. Okay, so if anybody has any follow-up questions to that, please feel free to send those in. Okay, so another good question that we've had asked in the past that I'd like to address now is, are steroids safe? So when we talk about steroids, there's a lot of misunderstanding about what steroids are. Steroids are a broad class of medications. The ones that we talk about are corticosteroids, and that's different than the anabolic steroids that some athletes use illegally in order to build up muscle. So these are different than those. These corticosteroids are steroids that are essentially mimic the proteins that are in your body, one of which is cortisol, that's a stress hormone. And it turns out that when used in high doses, much higher than your body would ever need for stress, for dealing with stress or producing an appropriate amount of energy, when used in very high doses, it causes the immune system to very broadly be suppressed. And so that's one of the benefits and one of the disadvantages of steroids. Very few of our medications that affect the immune system work as quickly, but they also can have more problems long term using them. So that's why we'll often use them short term initially until some other medication that we call a steroid sparing agent, because if you use it, it spares you from having to use the steroids long term until that medication starts to work. So corticosteroids like prednisone or prednisolone are safe in even fairly high doses short term, but it's something that should be a goal that you and your pediatric rheumatologist have to try to taper those off as soon as possible. Sometimes that's just a few days, sometimes it's a few weeks, and for some patients it's a few months. It's different in every case for every child, depending on what condition they have and how severe it is and how quickly they respond to the steroid sparing agents that take the place of the steroids to control their disease. Okay, we have a question that was sent in. My ANA test was positive. Should I worry? No, you should not worry. The ANA test is unfortunately one of these tests that's on all of these autoimmune panels or lupus panels or different things like that, and it's not actually that helpful for diagnosing most autoimmune conditions. However, because in pediatric rheumatology we don't have very many good blood tests that help us diagnose autoimmune conditions, so we're left with things like the ANA test, which is a small piece of the puzzle, but does not make the diagnosis, and the diagnosis is never made just based on an ANA test. So, or any other blood test for that matter. It always is a combination of the blood tests, the clinical features, so basically what symptoms your child has and what signs your child has on exam from their doctor, their pediatric rheumatologist, as well as any imaging such as x-rays or CT scans or MRIs, and also the history. How does it present? When does your child have the symptoms? What kind of symptoms? And what helps them or doesn't help them? So the positive ANA test is a starting point. I get many patients referred to me because their child complains of joint pain for more than one visit, which is fairly common and can be some cause for concern, particularly if your child has a lot of joint pain at certain times. But if there isn't any joint swelling or other symptoms such as fevers, rashes, unintended weight loss, other symptoms such as severe abdominal pain, then an ANA test is not very helpful. But I'm always ready, and any pediatric rheumatologist receives these consults on a regular basis, and we are more than happy to take a full look at all of the information, not just the ANA test, but also full evaluation, and then most commonly provide you reassurance that the ANA test is not important and does not mean your child has an autoimmune disease. In fact, 20 to 30% of healthy people who will never have an autoimmune disease have a positive ANA test. So you can see how that would be confusing and not very specific for an autoimmune condition. So don't worry, just talk to your doctor, and if it's appropriate, get a referral to a pediatric rheumatologist so you can kind of answer once and for all whether or not this is something you need to worry about, or if it's something you can just not worry about. So another question that we have is exercise safe for me with arthritis? Well, that depends. If you have a diagnosis of arthritis, inflammatory or autoimmune arthritis, such as children, so I'm not really covering adults here, because adults get something called osteoarthritis, which is a wear and tear arthritis that kids don't have because they haven't actually been around long enough to abuse their joints like us adults have, that cause degenerative changes in the joint that is not as a result of the immune system attacking the joints, but just from us abusing our joints. For inflammatory or autoimmune arthritis, like juvenile idiopathic arthritis, or autoimmune arthritis that could be part of a condition such as lupus or dermatomyositis, it is safe to exercise. However, it's important to try to get the arthritis under control so that there's not significant inflammation. When you have some active arthritis, when you exercise, there is a small but significant risk of increased injury to the joint. So generally when I start my patients on medications when they have active arthritis, I still encourage them to do some walking, but nothing high impact, and certainly not competitive sports until we have the joints really under good control, and that means that the pain has mostly been resolved, and most of the swelling, if not fully resolved, mostly resolved. And this is something that is very individualistic, so It's a good question that you should ask your pediatric rheumatologist about, because, like I said, every child is different, and it's impossible to just give you a blanket statement. But kids that are in full remission with juvenile arthritis or other causes of autoimmune arthritis, they can do anything other kids can do. There should not be any limitations, despite what some of the misconceptions are about kids with arthritis. Their joints should be in great shape, and they should use them and be normal kids. Okay, another question. I hurt all over. Can I stay home from school? Well, it depends. You know, this is a broad question, but it's a very good one, and one that I get asked frequently. It depends on what's causing all of the pain. If you have a fever of 101.3 or higher, or other signs of illness, like a severe cough or vomiting or diarrhea, other things like that suggest that you would benefit from staying in bed even if you don't have a fever, then that's okay. It's important to let our bodies rest when we're sick, and not least of which, not go to school and spread it to other kids if it's avoidable, and so you can make a quicker recovery, because rest is important in recovering from infections. Now, if you have pain from an injury, then that's something that you should be getting advice from your doctor or your orthopedic doctor. But generally, orthopedic doctors are very good at giving very explicit instructions as to when you can bear weight and such. So if it's pain from an injury, then that again is something that your doctor should be able to help you with. Now, if you don't have an injury and you don't have an infection, and you just kind of feel achy all over, if you feel that everything hurts, that's not normal, and that suggests that you might have something called amplified pain syndrome. This is a complex disorder. It's not an autoimmune condition, but that's something that can only really be determined after a full evaluation by a pediatric rheumatologist, to determine that your symptoms of pain and a sensitivity to pain and not feeling well are not the result of an autoimmune problem, but the result of a neurologic problem called amplified pain. So if you have amplified pain, again, this is something you need to work with your pediatric rheumatologist, but it's important to be able to work through the pain. But it's impossible to say until you actually see your doctor and then get a referral to a pediatric rheumatologist, whether if you have chronic pain, whether or not it's something that is truly an indication of damage that's being done by some disease process, or if it's simply your body misinterpreting pain signals from the rest of your body, in which case you need to work with your pediatric rheumatologist to make some changes in your life to help get you where you're feeling better. But in general, if there's not a disease process going on that's harming tissues, then it's okay and encouraged to go to school. But again, this is a decision that you need to make directly with your doctor, because every case is different. Okay, we have another one. One last question and then we're out. Do kids get rheumatoid arthritis? So the short answer to that is no. Kids get something called juvenile idiopathic arthritis, or JIA for short. It's been known as juvenile rheumatoid arthritis for many, many years, and in fact on the billing sheets, official coding in medical offices, it's still called JRA, which is unfortunate because they didn't ask us pediatric rheumatologists if we agreed with that. That is, and the reason why we don't like the term JRA, even though it is the same as JIA, is because it causes confusion about whether or not kids have rheumatoid arthritis but are just happen to be juveniles or young people with rheumatoid arthritis. And only about 5 to 10% of kids, and these are almost certainly kids that are in their early or mid or late teens, that have autoimmune arthritis and have certain blood tests such as rheumatoid factor or anti-CCP antibody that are positive, and also have a certain distribution, meaning where their joints are affected, like in their hands, that are similar to patients, adult patients with rheumatoid arthritis. Those kids do have something that we still call juvenile idiopathic arthritis, but we call it rheumatoid factor positive, or an older term is seropositive juvenile idiopathic arthritis. But again, that's the minority. The vast majority of kids do not have rheumatoid arthritis, because you really have to be over 15 years of age in order to have rheumatoid arthritis. And in most cases, even kids up to that age, 16 or 17, can often be diagnosed with juvenile idiopathic arthritis. And we sort of know this because their labs in general, people, young adults or older adults with rheumatoid arthritis, have inflammation throughout their body that you can pick up on lab tests. This is not true in general for kids with juvenile idiopathic arthritis. So that's why lab tests are not very helpful in diagnosing this, and why it can't exclude the diagnosis, and it can't make the diagnosis. The diagnosis for juvenile idiopathic arthritis is very simple. You have swelling in a joint, most times something you can see, but sometimes you can't see the swelling, for 6 weeks or longer, that's not due to an infection or to an injury, and that's it. Whereas for adult RA, there's a lot other issues that can go into helping make that diagnosis. The term idiopathic just means that we don't know what causes it. We know that it's a problem with the immune system, but we don't fully understand what triggers it in some kids and not in others. Rheumatoid arthritis and juvenile idiopathic arthritis have in common that they are both autoimmune diseases where the immune system gets confused, and instead of just fighting off bacteria and viruses, some of the cells in the immune system recognize our own body, and in case of arthritis, tissues in our joints as foreign and attack them as such, and that's why you have the inflammation. Your body thinks that your joints are an infection to be fought, and that's why we have to use medications in order to get those cells to calm down and stop attacking your own body. Well, that's all for this week. Thank you very much for tuning in. I look forward to seeing you every week, and feel free to send any additional questions that you have, and I will try to answer those as best as possible. Have a great weekend, everybody. Take care.